Today's topic is orbit. First we will discuss about bony orbit, then we will discuss about what are the different structures which are present in the bony orbit. I have taken norma frontalis here and I have magnified bony orbit here to see what are the bones which are forming the bony orbit. See, here two bony orbits are there on either side of the root of the nose, and it is pyramidal shaped. If you wanted to be very specific, it is four-sided pyramid. It is four-sided pyramid. So, four-sided pyramid means what? It will be having the roof, floor, medial wall, lateral wall. So, this is four-sided pyramid. Now, you can see roof, floor, medial wall, lateral wall, apex and base. Right? Now we will see what are the different bones which forms the different walls of the bony orbit. First we will see what are the bones which I have drawn here, so that you will get one idea, so that you can only tell the different boundaries of orbit. What is this bone? Frontal bone. Is it? So this is frontal bone. So that what is this? This is also frontal bone. What is this bone? This is sphenoid bone. Sphenoid bone having the lesser wing and greater wing. So this is lesser wing of sphenoid. This is greater wing of sphenoid. And what is this bone? Zygomatic bone. See, this is zygomatic bone. This part only I have drawn here. So this is zygomatic bone. And what is this bone? What is this? Maxilla. So this is maxilla. Orbital surface of maxilla. And what is this bone? This is also maxilla only, but which process? Frontal process of maxilla. So here also maxilla. And what is this bone? This is lacrimal bone. And what is this bone? Ethmoid bone. Orbital surface of ethmoid bone. And what is this small bone here? This is orbital process of palatine bone. This is palatine bone. Right? Now we know what are the bones which are forming the bony orbit. Now we will see what are the bones which are forming the roof, what are the bones which are forming the floor, and what are the bones which are forming the medial wall and lateral wall. First, if we take roof, see, this is roof. So, what are the bones which are forming the roof? This is roof. What are the bones? See, frontal bone. Roof is formed by frontal bone, and what is this? Lesser wing of sphenoid. Frontal bone and lesser wing of sphenoid. Right? Then, if you take lateral wall is formed by, see, this is lateral wall. Okay? Lateral wall is formed by, what is this? Greater wing of sphenoid and zygomatic bone. Greater wing of sphenoid and zygomatic bone. Then what is this? Floor. Floor is formed by, what is this bone? Zygomatic bone plus, what is this? Orbital surface of maxilla. So maxilla. Then here this small bone is there. What is this? Palatine bone. So orbital process of palatine bone. So these are bones which are forming the floor. Then what is remaining here? Medial wall. Is it? Medial wall is formed by frontal process of maxilla. See, this is medial wall. Medial wall is formed by frontal process of maxilla. Then what is this? Lacrimal bone plus, what is this? Ethmoid bone. Orbital surface of ethmoid plus, what is this bone here? Body of sphenoid. Body of sphenoid. Right? So these are the bones which are forming the different walls of the orbit. Recollect once again. Roof is formed by frontal bone and lesser wing of sphenoid. Lateral wall is formed by zygomatic bone here and greater wing of sphenoid. Right? Lateral wall is formed by zygomatic bone and greater wing of sphenoid. Floor is formed by zygomatic bone and maxilla. If you wanted to say specifically, orbital surface of maxilla and palatine bone. Clear? So this is about floor. Then medial wall. See, this is medial wall. Medial wall is formed by frontal process of maxilla, lacrimal bone, ethmoid bone, body of sphenoid. Right? Now we know what are the different bones which are forming the different walls of orbit. Right? Now we will see what are the special features in the roof, lateral wall, floor and medial wall. This is roof. In the roof, you can see one fossa at the anterolateral part. You can see one fossa here. That fossa, what we are calling lacrimal fossa. It will give accommodation for the lacrimal gland. That's it. Then anteromedial part. Here anterolateral part. What is that fossa? Lacrimal fossa. Anteromedial part also you can see one fossa. That fossa what we are calling trochlear fossa. What is it? Trochlear fossa. It will give attachment to the fibrous pulley. It is for the superior oblique muscle that we will discuss. So this is trochlear fossa. Right? Then at the junction of roof and medial wall, you can see one foramen here or one canal here. What is this canal? Optic canal. What is it? Optic canal. That I have magnified here. See, this is optic canal. Right? Through the optic canal, optic nerve and ophthalmic artery is passing. So these are the special features which are present in the roof. Recollect once again. Lacrimal fossa for the lacrimal gland, trochlear fossa for the trochlea. At the junction of roof and medial wall, you can see the canal. That canal is optic canal. Through that canal, optic nerve and ophthalmic artery is passing. Then, what are the relations? Above the roof, what is there? If you take the transverse section of skull and if you see interiorly, that means if you remove the brain and if you see interior, what you can find? I am taking the cut section. See, this is cranial cavity. In the center, you can find body of sphenoid, anterior cranial fossa. This is medial cranial fossa and this is posterior cranial fossa. In the posterior cranial fossa, foramen magnum. So this is anterior cranial fossa. This is medial cranial fossa. This is posterior cranial fossa. The floor of the anterior cranial fossa formed by orbital plate of frontal bone. This plate is orbital plate of frontal bone. That means if you break this orbital plate of frontal bone, you can enter into orbit. That means superiorly it is related with anterior cranial fossa. Superiorly it is related with anterior cranial fossa. Any difficulty up to here? If no, we will go for lateral wall. See, this is lateral wall. Lateral wall is formed by zygomatic bone and greater wing of sphenoid. And what are the special features in it? See, at the junction of roof and lateral wall, here one fissure is there. This fissure what we are calling superior orbital fissure. What is it? Superior orbital fissure. Right? This superior orbital fissure divided into three parts by one common tendinous ring of Ginn. What is it? Common tendinous ring of Ginn. See, I have taken this superior orbital fissure along with optic canal and I have magnified here. See, this superior orbital fissure divided into upper part, middle part and lower part by common tendinous ring. This common tendinous ring of Ginn encircles the optic canal and the lower part of superior orbital fissure. Right? This ring will give origin to the superior rectus, inferior rectus, lateral rectus and medial rectus muscles. So this is common tendinous ring of Ginn. It will be present like this. Clear? So if it is divided into upper part, middle part and lower part, what are the structures passing through the upper part, what are the structures passing through the middle part and what are the structures passing through the lower part? Right? If you coming from lateral to medial side, in the lateral most part you can see the artery. This artery is recurrent meningeal branch from the ophthalmic artery. What is it? Recurrent meningeal branch from the ophthalmic artery. And what is next structure here? This is lacrimal nerve. This is lacrimal nerve. And what is this? This is frontal nerve. What is it? Frontal nerve. And what is this? Fourth cranial nerve. Then what is this? Superior ophthalmic vein. So these are the structures passing through the lateral part or upper part of superior orbital fissure. Recollect once again. Recurrent meningeal branch from the ophthalmic artery. This is lacrimal nerve. This is frontal nerve. This is trochlear nerve. That means fourth cranial nerve. And this is superior ophthalmic vein. Right? These structures we will discuss in the contents. At this session, just remember the names. Right? Then in the middle part. This is in the middle part or within the common tendinous ring of Jin. See, this is third cranial nerve only, but upper division. This is also third cranial nerve only, but lower division. So upper division and lower division of third cranial nerve. Then in between, nasociliary. What is it? Nasociliary. Right? Then what is this nerve? This is sixth cranial nerve. So you remember like this, 3 plus 3, 6. Right? In between these three, you can find nasociliary nerve. Clear? So these are the structures passing through the middle part of superior orbital fissure. Then in the lower part, inferior ophthalmic vein. Clear? This question may expect in the examination as a 3 marks question. So recollect once again. Recurrent meningeal branch of ophthalmic artery, lacrimal nerve, frontal nerve, fourth cranial nerve, superior ophthalmic vein in the upper part. In the middle part, upper division of third cranial nerve, lower division of third cranial nerve. In between these two, nasociliary and abducens nerve or sixth cranial nerve. These are the structures in the middle part. In the lower part, inferior ophthalmic vein. That's it. And here you can see one foramen here. This foramen is foramen for the zygomatic nerve. This is foramen for the zygomatic nerve. Right? And one more feature is there. In the orbital margin of lateral wall. In the orbital margin of lateral wall, you can see one bony nodule or bony tubercle. That bony tubercle, what you are calling Whitnall's tubercle. What is it? Whitnall's tubercle or zygomatic tubercle. This Whitnall's tubercle or zygomatic tubercle gives attachment to the lateral check ligament. That I will tell you what is lateral check ligament. So these are the special features in the lateral wall. And what are the relations? See, greater wing of sphenoid separating the orbital cavity from the middle cranial fossa. Right? And zygomatic bone separating the orbital cavity from the temporal fossa. Right? So these are the relations. Now, floor. Floor is formed by zygomatic bone, maxilla and palatine bone. Right? Then what are the special features in it? Here you can see one more fissure here like this. What is this fissure? If it is superior orbital fissure, this is inferior orbital fissure. That's it. So this is inferior orbital fissure. And you can see one groove here. This groove, what we are calling infraorbital groove. That infraorbital groove continues as canal. That canal we cannot see. That's what I have drawn dotted lines. That canal will be opening or that canal will be leads to the one foramen here. This foramen what we are calling infraorbital foramen. Clear? So what are these? Inferior orbital fissure, infraorbital groove, infraorbital canal. Then we will see what are the structures passing through the inferior orbital fissure. Through the inferior orbital fissure, there will be passage of zygomatic nerve and infraorbital vessels and nerves. Infraorbital vessels and nerves. Actually, infraorbital nerve, it is continuation of maxillary nerve that we will discuss. Okay. So at this session, you remember that infraorbital vessels and nerves, then zygomatic nerve, along with that orbital branch of pterygopalatine ganglion. Orbital branch of pterygopalatine ganglion. These are the structures passing through the inferior orbital fissure. Then what are the structures passing through the infraorbital groove and canal and also through the foramen? This foramen is infraorbital foramen. Through all these structures, corresponding vessels and nerves are coming. What are those? Infraorbital vessels and nerves. Infraorbital vessels and nerves are passing through these structures and they comes out through this foramen. Any other special feature is there? Yes. At the anteromedial part, here you can see one groove. This groove is for the origin of inferior oblique muscle. What is it? Origin for the inferior oblique muscle. Right? So these are the special features in case of floor. Then what are the relations? Below it, what will be there? This is maxilla. Maxilla contains maxillary air sinuses. So floor separating the orbital cavity from the maxillary air sinus. Right? That's it about the floor. Then we will go to the medial wall. This is medial wall. Medial wall is formed by maxilla, lacrimal bone, ethmoid bone, body of sphenoid. See, frontal process of maxilla, and this is lacrimal bone, ethmoid bone, body of sphenoid. Right? What are the special features in it? See, at the junction of maxilla and lacrimal bone, you can see one fossa here. See, this is fossa. This fossa what we are calling lacrimal fossa. Right? This lacrimal fossa is formed by lacrimal crest of maxilla. That means lacrimal crest of frontal process of maxilla. Otherwise simply lacrimal crest of maxilla and crest of lacrimal bone. That means if you take the section through the lacrimal fossa, you can see like this. This is the lacrimal fossa. Right? This is lacrimal crest. So this is fossa. This fossa is formed by anteriorly by maxilla, posteriorly by lacrimal bone. Right? And here this is fossa. Right? This fossa contains lacrimal sac. What is this? Lacrimal sac. Then this fossa bridged by one fascia. That fascia what we are calling lacrimal fascia. Actually this lacrimal fascia is derived from the periorbitia or orbital fascia, that we will discuss. This is the lacrimal fossa. And any other features are there? Yes. See here, at the junction of roof and medial wall, you can see two foramens. These foramens are anterior and posterior ethmoidal canals or ethmoidal foramens. These anterior and posterior ethmoidal canals will give passes for the corresponding vessels and nerves. Clear? At this session you remember that, that is sufficient. That is about medial wall. And what are the relations of it? See, medial wall separating the nasal cavity and separating the ethmoidal air sinuses, and it is separating the sphenoidal air sinuses. That means medial wall related with nasal cavity, ethmoidal air sinuses and sphenoidal air sinuses. Clear? So these are the relations. Then what is remaining? This is apex and base. Apex and base is remaining, right? So apex is formed at the medial end of superior orbital fissure. Apex will be present at the medial end of superior orbital fissure. Actually through that optic canal is passing. Then base is formed at the face, is it? So this base is formed by orbital opening on the face. So this is totally base. Clear? Now we have completed different boundaries of bony orbit. Right? Now we will see what is orbital axis. Orbital axis is nothing but if you make one imaginary line through the central part of base, and that line has to pass through the optic canal. Right? That axis what we are calling orbital axis. What is it? Orbital axis. If you want to see that, see, medial wall is parallel to each other. See, medial wall of bony orbit is parallel to each other, but lateral walls are right angle to each other. See, this is medial wall, this is lateral wall. Right? Lateral walls are right angle to each other, but the medial walls are parallel to each other. That means bony orbit is directed like this. Clear? So if the bony orbit is in this position, eyeball will be present like this, is it or not? So this is eyeball, and here optic nerve will be present. So this is optic nerve. This is orbital axis, right? Then if you make the visual axis will be passing like this, right? So the angle between the orbital axis and visual axis is around 20 to 25 degrees. 20 to 25 degrees. Clear? So this is orbital axis. With this we have completed bony orbit. After break we will discuss about structures which are present in the bony orbit one by one.